You can still smile without feeling self-conscious, even if you've lost a tooth. Just ask your dentist whether a dental implant could be the solution. Dr. Youssef Obeid is medical director of Obeid Dental, and he's here now with advice. He's also a clinical professor at the University of Maryland Dental School. And dentistry was on the first page of the Washington Times this morning because they're talking about stress showing up in teeth, people grinding. You can really see what's going on in a person's body through their teeth?
You can. You know, if you're in a lot of stress, the next thing you know is you're grinding your teeth and you'll see those little nubby teeth. So yeah, you can tell a lot. You know, people with short teeth tends to be very, you know, type A personality, you know, stressed out. And
but you were here to talk about dental implants, and we talked, that's losing a tooth.
Yes.
And the doctor put these two instruments on the table, and when I saw them, I'm thinking, this is why people fear dentists. But then the doctor held up something else. Doctor, would you hold that up and hold it right in front of you? And he said, this is what really is going into you. Hold it steady.
This is the real deal.
Versus this.
Yeah, this is what we use. This is just to show patients what an implant is and the shape of it, you know, the steps that's going to get involved into start it and finish with implant treatment.
Well, let's go back a little. People have been losing teeth for all kinds of various reasons since the humans first came on the planet. When did the implant become the solution to the tooth loss?
Well, we had implants for a long time. You know, we had it since the 80s, actually. It started in the 1970s in Sweden, and then it came to the US, and we started doing it in the 80s. Right now, we start seeing more and more of it because we know for sure that implants is working. You know, the debates whether implants works or not, it's long gone. We know that it works right now, and actually the final restorations that will be placed on those implants are just getting better and better. The technology is getting better. And also our patient awareness with the presence of dental implants is much higher than ever before.
Who is a candidate for dental implant? We see sports stars, especially hockey players, losing teeth. Children lose teeth from tooth decay or whatever. Who's the person should get an implant?
Anybody, actually. You know, I mean, we don't have an age limitations or social limitations. Anybody above certain age, you know, usually we don't want to place it in growing children's. You know, we have an age limit of 18 and then up to whatever, 90. But as long as you're healthy and as long as you have the bone and you have a missing teeth, that you're a candidate for dental implants.
When you go to the dentist for this, what should people expect? Are they going to be knocked out completely? Do they hear grinding sounds?
Well, it's still a surgery, you know, no matter how advanced we're getting, but it is still a surgery. They might expect that they will be under local anesthesia. Most of the time, I will do most of my surgery under local anesthesia, unless if the patient is really afraid. Then we go to IV sedation and things like this. But most of the time, this is done on an outpatient procedures. You come in, you know, with the advancements of the CT scans and the pre-treatment diagnostic features, the surgical time is cut down tremendously. So you don't have to spend a lot of time in the chair. Most of the diagnosis will be done before. So you're coming in, you know, it will be easier than taking a tooth out, for example.
Besides the aesthetics of having that gaping hole filled, what are the other benefits and reasons why people should consider dental implantation?
Well, restoring aesthetic is one factor, but it's not the only factor. Placing implants in the missing tooth area also help preserve the bone. If you take a tooth out and you don't restore it, the bone tends to disappear. So having an implant inside your bone, you know, help maintaining the bone heights and quality, and also will provide, you know, we're talking about just one missing tooth. Now if we're talking about multiple missing teeth, then it will really change your lifestyle, you know. We're going from having, you know, this old style dentures that, you know, our grandfather used to wear and take them out, put them aside before they go to bed. If we can able to help these patients and get them fixed type of prostheses with multiple implants, then that will be a lot.
Doctor, anything else we need to know that we haven't considered in a dental implant?
Don't be scared of dental implants. They're not that painful, you know, and they work very well, and they feel like your own teeth, and get them and enjoy them.
All right, and they're not that big.
They're not that big.
Thank you very much,
You're
Doctor.
welcome.
Let's go to Angie now. She has an update on the rush hour.